when you're taking your history, some of the questions were not well targeted. So asking somebody who's got hot flushes whether they are feeling hot when other people are feeling cold is not the best way of distinguishing between thyroid pathology. You could ask whether they feel like their heart racing.
Yeah.
Okay. These would be more targeted questions to help you establish, or have they been sweating a lot? Some of the question in terms of the suitability for HRT came much later in the clinical management. The first thing the patient came in with was, I'd like to start HRT. You should already be thinking about checking whether there's like any contraindication. Not wait when you get in the management to do that, because that messes the structure. Okay. Other things worth to cover here would be cervical screening. Okay, especially starting them on HRT. The bit where it was quite awkward was about the sexual issue. So you need to signpost it sensitively. Don't say personal, because personal might make the patient feel a little bit uncomfortable to reveal things. So you need to actually signpost it in a way that sounds it's perfectly common for women to have these issues. So what I could say is that some women may notice a bit of issues when their body change with menopause. I need to ask some sensitive question. Is that okay with you? Then I ask, have you noticed any vaginal dryness? Has it affected your relationship? So that way it won't feel like a bit awkward when you're asking it.
Yeah.
Is this clear so far?
Yeah, it's very good actually. Yeah.
The other
But
problem
it was
was,
a bit uncomfortable even. I could sense
yes.
it, but I didn't know.
So as a doctor, you should ask it as a matter of fact and don't feel like embarrassed about asking these.
Yeah.
Okay. There was some question where you lost a bit of time when you were just clarifying the same thing, like you're asking the patient, so the main thing is you've been having hot flushes, is that right? Like this question is useless because you're just going round in circle. So it's much better to ask question that allows you to find new information. Okay, so that will save you time. The other thing is you did connect with the patient. However, you could have done it much earlier. So in the beginning, when she said, I've been having these hot flushes, it's really bad, it's affecting me. You just say, okay, and you ask your next question. It's only around like 3 minutes in the consultation, then you acknowledge and gave a receipt and you said something like, sounds distressing. If you did it earlier, I think you had built more rapport with the patient and they might have been more comfortable to open up. Okay, so in the beginning felt a little bit like an interrogation until you started acknowledging. The management plan here, do you think the examiner will know which patch you're talking about? Like if they had to mark you, whether it's safe prescribing, whether you're going to give the right one, they would not be able to because you haven't verbalized the name of the medication.
Yeah.
So you have to say whether it's Everett
Several
Conti.
times. Yeah.
Otherwise, it can't read your mind. Okay. And you could also offer Vagifem here for the vaginal dryness.
Yeah.
Because you did pick up there were some issues. And if you have a bit more time, you can discuss a little bit lifestyle as well, like having a fan, especially if she tells you she's a teacher, having these hot flushes during a class might be quite embarrassing for her. All right. Wearing light fitted clothing. And in terms of the other thing that I noticed is that you kind of delayed the prescription, but did you realize that the patient already had a BMI and blood pressure check a month ago?
Yeah.
So potentially you could consider starting it. Have you got any question?
Yeah. No, I think very point. It is a big station, but again, I think it can be managed if with the right approach.
Yeah, I mean,
But,
obviously, like if you do it a few more times, you're going to get more slick at it.
yeah.
And the examiners can tell if somebody's done a case just one time or they've done it 3 or 4 times and they're more smooth.
Thank you very much, Evan. I think it was a very great experience, really. Not only involving, with when other people are around and real actors, and because that's where we do practice, in our groups and all that. But I think it is very different.
Have you found the insights in this video useful so far? If so, you might be interested in SCA blueprints. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days.
You get the feedback straight away because they are actors. So, and then you can actually, perform in a way that is needed in the exam. So, and I think we did 3 consultations. So yes, I think main thing is whatever shortcomings are there, if they can be implemented straight away in the next consultation and next consultation. So at least if there's an improvement. But yeah, but again, I think it's a long way to go and still needs a lot of improvement. But I think in a way, looking back at the videos, that will be very helpful, and your feedback, and not repeating the same problems again and again, and writing down all the mistakes or the problems. I think that will reinforce the improvement, I think.
Yeah.
So
So let's make it more specific. Like, what's the biggest learning point for you today?
I think for me would be, I think, keep practicing, and not to forget that, stick to the structure. I think that's more important, and
Hmm.
be basically yourself, because a lot of time, as I said, you hear things and then you just move on. But I think important thing is just active listening is more important. That's what I heard, I got from today. Because if you are actively listening, I think you will respond, and that will look real, and I think that will improve the consultation overall. So that's
Yeah.
what I got a lot of help in that respect today.
Yeah. So I think what you need to work on is actually sharpen the quality of your questions. So you ask better question, as in, this is where it will help you to ask question that will be allowing you to progress. Like there was one occasion when you asked, so is sleeping okay? Which it's not really that useful. And this will like comes down to active listening, which you mentioned. If you know he's agitated, he's in a lot of pain, pain is quite bad, probably he's not sleeping, and then you can ask more targeted question. And the other thing here is you mentioned about the structure. So when it comes to structure, make sure you have a checkpoint at around 6 minutes to see where you're at, because you tend to go a little bit over that, and you're so comfortable in data gathering. If you found this video useful, you might want to watch this video in which I go more depth on clinical management. Click the video to watch it. Take care, everybody. Bye bye.